What if I told you that the pill you swallow every morning to protect your health, the one your doctor described as a standard precaution, might actually be the very thing making you feel foggy, dizzy, or even putting you at a sudden risk of a fall? I know that sounds like a bold claim. You've been told for years that as long as you take your prescriptions, you're doing the right thing for your longevity. But there is a massive gap between a medication being safe for a 40-year-old and that same medication being safe for you today. For millions of seniors, that gap is where the danger hides. Today, we aren't just talking about side effects listed in tiny print on a pharmacy insert. We are talking about the subtle, often ignored chemical shifts that happen in your body after 60, the brand new clinical data that explains why some common pills effectively become toxic as we age, and the specific warning signs you need to look for before your next dose. By the end of this video, you're going to know the 5 most common medications that become dangerous after age 60, why your normal dosage might be a total overdose for your current metabolism, and what the latest 2026 research says about how to manage your health without these hidden risks. This is information your doctor likely doesn't have time to explain in a 15-minute appointment, but it's information that could quite literally save your life. So stay with me. This one matters. Hey, welcome back to the channel. If you're joining us for the first time, this is the place where we break down the real science behind aging, heart health, and longevity, without the hype, without the scare tactics, and without trying to sell you a miracle supplement. Today we're tackling something that genuinely shocked me when I started digging into the latest geriatric pharmacology studies. Most of us assume that if a drug is FDA approved and prescribed by a professional, it's a constant. But your body is not a constant. Your kidneys, your liver, and even the barrier protecting your brain all change as the decades pass. What was a lifesaver in your 40s can become a liability in your 70s. In fact, adverse drug reactions are one of the leading causes of hospitalization for seniors in the United States. Yet many of these incidents are entirely preventable. To understand why certain pills become red zones after 60, we first have to understand the mechanics of the aging body. Think of your body like a filtration plant. When you're younger, the filters are brand new and high speed. You take a pill, your liver processes it, your kidneys flush out the excess, and the system stays balanced. But as we get older, our total body water decreases and our percentage of body fat typically increases. Why does that matter? Because many medications are either water-soluble or fat-soluble. If there is less water to dilute a drug, the concentration in your blood becomes much higher than the manufacturer intended. If a drug is fat-soluble, it can get stored in your tissues for much longer, lingering in your system like an uninvited guest. This brings us to our first dangerous category, the sleep trap medications. Most seniors have experienced it, that frustrating inability to stay asleep, or the alpha-delta sleep where you never feel rested. It's tempting to reach for a common sleep aid, specifically benzodiazepines or Z drugs like zolpidem. While these might have been fine for occasional use years ago, the 2026 data is clear. After 60, these drugs stay in your system much longer. Because your liver metabolism has slowed down, a pill taken at 10 p.m. is often still active in your brain at 8 a.m. the next morning. This leads to what clinicians call residual sedation. You might feel a bit clumsy or groggy, but the real danger is the 50% increase in hip fracture risk associated with these medications. Your balance and reaction time are compromised. Furthermore, new research suggests a frightening link between chronic use of these sedatives and an accelerated decline in cognitive function. If you feel like your memory is slipping, it might not be aging, it might be your sleep pill. The second pill that enters the danger zone is something millions of people take daily for prevention: aspirin. For decades, the mantra was, an aspirin a day keeps the heart attack away. But the science has moved on, and if you are over 60 and have never had a heart attack or stroke, the math has changed. Your stomach lining thins as you age, and your risk of a major internal bleed increases significantly. Recent 2026 guidelines from major cardiovascular associations emphasize that for seniors without established heart disease, the risk of a life-threatening gastrointestinal or brain bleed often outweighs the protective benefits of aspirin. If you are still taking a daily aspirin because that's what people do, you need to have a serious conversation with your doctor about your specific risk profile. It is no longer a one-size-fits-all recommendation. Sign number 3 involves a class of drugs you might be taking for your stomach. Proton pump inhibitors, or PPIs. These are the common pills for acid reflux or heartburn. They are available over the counter, which gives a false sense of absolute safety. However, when taken long-term after age 60, PPIs do something silent and destructive. They block the absorption of critical nutrients. Your gut needs acid to break down calcium, magnesium, and vitamin B12. Without these, your bones become brittle, your heart rhythm can become irregular, and your nerves can start to misfire. In fact, a major review published in early 2026 found that seniors on long-term PPIs had a significantly higher rate of bone fractures and a mysterious increase in the risk of certain gut infections like C. diff. If you've been on these for years, your silent pill might be hollowing out your skeleton. The fourth category is one of the most common prescriptions in the world, certain types of blood pressure medications, specifically those that are alpha blockers or older central-acting agents. As we age, our baroreceptors, the sensors in our neck that tell our brain to adjust blood pressure when we stand up, become less sensitive. If your medication is too aggressive or of a certain type, you can experience orthostatic hypotension. This is that sudden head rush or blackout feeling when you stand up from a chair. In seniors, this is a leading cause of emergency room visits due to fainting and subsequent head injuries. The 2026 research suggests that many seniors are overmedicated because doctors are chasing a number on a cuff rather than looking at how the patient feels. If your blood pressure is 120/80, but you feel like you're going to pass out every time you get out of bed, your medication is a danger to you. Finally, the fifth danger comes from anticholinergics. These are found in a massive variety of drugs, from over-the-counter allergy meds and nighttime pain relievers to prescriptions for overactive bladder. These drugs work by blocking acetylcholine, a chemical that sends signals between nerve cells. The problem? Acetylcholine is also the primary chemical involved in memory and learning. In a younger brain, the body can handle the blockage. In a senior brain, these drugs can cause acute confusion, blurred vision, and dry mouth. More alarmingly, the cumulative effective dose research shows that the more of these drugs you take over a lifetime, the higher your risk of developing permanent dementia. If your allergy pill is making you forget where you put your keys, it's not a side effect, it's a warning. But here is where the science gets even more nuanced. It's not just that these drugs have side effects, it's that they interact with your biological clock in ways we are only just beginning to map out. This is a field called chronopharmacology. In 2026, we've discovered that taking a medication at 8 a.m. versus 8 p.m. can be the difference between a therapeutic success and a toxic event. For seniors, whose circadian rhythms are often shifted or dampened, this timing is everything. For instance, if you take a diuretic in the evening, you aren't just dealing with frequent bathroom trips. You are disrupting the deep sleep cycles necessary for your brain to clear out metabolic waste. Over months, that lack of brain-cleaning sleep contributes to the very cognitive decline we are trying to avoid. So, if you or a loved one are taking these, what does the newest research say you should actually do? It's not about stopping your meds tomorrow. That can be equally dangerous. It's about a process called deprescribing. This is a growing movement in medicine where doctors and patients work together to reduce or eliminate medications that are no longer beneficial. The 2026 guidelines are shifting toward minimal effective dosing. First, let's talk about the metabolic reset. Because your body composition has changed, many seniors find that they can achieve the same health benefits with half the dose they took at age 50. Second, we have to talk about nutrient restoration. If you must be on a medication like a PPI or a diuretic, you must be proactive about your mineral levels. Research shows that for your heart and bones to stay protected, you need a specific sodium-potassium-magnesium balance that many medications actively disrupt. Increasing your intake of potassium-rich foods and ensuring you are getting highly absorbable magnesium can actually buffer the side effects of many necessary prescriptions. It's about giving your body the raw materials it needs to handle the chemical load. Third, the impact of liver and kidney support. Your organs of detoxification are the unsung heroes of your medication regimen. If they are sluggish, the pills become toxic. The latest 2026 data suggests that simple habits, like maintaining optimal hydration and supporting liver health through bitter greens and cruciferous vegetables, can significantly improve how your body clears medications. When your filters are working better, the drug doesn't linger in your bloodstream long enough to cause those dangerous, creeping side effects. Furthermore, we need to address the cascading effect. This is when a doctor prescribes a second medication to treat the side effects of the first one, and then a third to treat the side effects of the second. For seniors, this cascade is often where the most damage occurs. If your blood pressure med makes your ankles swell, and then you get a diuretic to fix the swelling, which then causes a potassium deficiency leading to heart palpitations, which then gets you a heart rhythm pill, you can see how quickly the system breaks down. The 2026 approach is to stop the cascade at the source. Instead of adding a pill, we look at whether the first pill was truly necessary, or if there is a modern, safer alternative that doesn't cause that initial swelling. Now, I want to address something very important for my viewers who feel trapped between their symptoms and their side effects. This is why the latest medical consensus is moving toward lifestyle-first intervention. For example, if you are taking a dangerous sleep aid, the new 2026 protocols recommend cognitive behavioral therapy for insomnia, CBTI, and specific morning light exposure before reaching for a pill. For acid reflux, identifying personal food triggers, often things like industrial seed oils or ultra-processed grains, can eliminate the need for PPIs entirely. We are moving away from the era of a pill for every ill and into an era where we use biology to fix what chemistry only masks. I want to be very clear. Never ever stop taking your medications cold turkey. This is especially true for blood pressure or heart medications, as rebound effects can be life-threatening. The goal of this video is to give you the vocabulary to talk to your doctor. Use the term the Beers criteria. This is a list maintained by the American Geriatric Society of medications that are potentially inappropriate for seniors. Most doctors know it, but they don't always check it unless you bring it up. If you are experiencing unexplained fatigue, sudden balance issues, or brain fog that feels like a heavy blanket, you need to advocate for a medication audit. Your health isn't a static prescription written 10 years ago. It's a living, breathing reality that needs to be updated. I want to zoom out for a second because I think this research represents something really important about how we think about aging. For most of medical history, we've treated seniors like older versions of young people. We've used the same dosages, the same drugs, and the same protocols. But what the 2026 geriatric research is showing us is that the senior body is a unique biological state with its own set of rules. We are finally beginning to respect the complexity of the aging metabolism. That changes the game. It means that aging well isn't about how many pills you can take to stay alive. It's about how few pills you need because your body is functioning optimally. Instead of just accepting side effects as part of getting old, we are moving toward a future of precision geriatrics. This involves looking at your genetics, your gut microbiome, which we've talked about in previous videos, and your current organ function to tailor a health plan that is as unique as your thumbprint. There are already clinical trials underway testing whether we can use simple biomarkers to predict exactly which seniors will have a bad reaction to certain heart medications. We're at the very beginning of this story, but the direction is unmistakable: personalized, minimal intervention medicine. Another fascinating area of current research is bioidentical modulation. In 2026, scientists are looking at how we can use substances your body already produces, like specific peptides or amino acids, to manage conditions that we used to treat with harsh synthetic drugs. For seniors, this is a revolutionary shift. It means we are working with your body's own software instead of trying to hack it with external chemicals that the liver struggles to recognize. This soft-touch medicine is showing incredible promise for things like mild hypertension and age-related cognitive slowing, providing a bridge that lets us taper off those heavier, more dangerous prescriptions. Look, I know this is a lot of information, and I don't want anyone walking away from this video feeling scared of their pharmacy. That's not the point. The point is that, for the first time, we have the data to show that more is not always better. We're seeing a path forward that involves empowerment. It involves asking the right questions. It involves recognizing that you are the primary stakeholder in your own health. You are not just a patient, you are the manager of your own biological machine. You have the right to ask your provider, why am I still taking this? And is there a version of this treatment that respects my 2026 biology? This new era of health also demands that we look at environmental factors that influence drug toxicity. For instance, the temperature of your home and your level of daily sun exposure can actually alter how your body metabolizes lipid-soluble medications. Recent studies have even highlighted that common household cleaners can induce liver enzymes that speed up the breakdown of some drugs while slowing others, leading to unpredictable levels in your bloodstream. By taking control of your environment, you aren't just living clean. You are actively optimizing the chemical environment in which your medications operate. This holistic view is the cornerstone of 2026 longevity science. We are no longer looking at the pill in a vacuum. We are looking at the pill inside a complex, aging, and highly adaptable human system. If there's one thing I want you to take away from this video, it's this. The way your body reacts to a pill today is different from how it reacted yesterday. Every dose is a biological event. Being mindful of these 5 danger zones gives you the agency to steer your health toward longevity and away from preventable harm. That's not a scare tactic. That's an opportunity to reclaim your vitality. When you clear out the chemical clutter that your body can no longer handle, you often find a level of energy and clarity that you thought was gone forever. If this video helped you or taught you something new, I'd genuinely appreciate it if you'd hit that like button. It helps get this vital information to other seniors who might be suffering in silence, and subscribe so you don't miss our deep dives into healthy aging. I've got more videos coming on how to naturally boost circulation, the truth about vitamins after 65, and how to protect your brain as you age. I'd love to have you along for the ride. Drop a comment down below. I want to hear from you. Have you ever had a bad reaction to a common medication? Did you find that a normal dose was too much for you? Have you successfully worked with your doctor to reduce your prescriptions? I read the comments, and your experiences often help other people in this community feel less alone in their health journey. Your story might be the exact thing someone else needs to hear today. Maybe you've noticed that since stopping a certain allergy pill, your senior moments have completely disappeared. Share that, because someone else is likely struggling with the same mystery. We're in this together, and your voice matters. Take care of your liver, take care of your kidneys, take care of your brain, and most importantly, take care of yourself. You've worked hard to reach this stage of life. You deserve to enjoy it with a clear mind and a strong body. Your health is your greatest wealth, so invest in it wisely every single day starting right now. I'll see you in the next one.